The Chinese virologist, and if our viewers recollect, she was one of the first ones to have actually blown the lid of how this could have been a lab-made virus. Dr. Yan, thank you so much for speaking with us here on CNN News 18. And I want to get you in as far as the new revelations that are being made by several epidemiologists, where the estimates are that 60% of China, or at least 10% of the world, is soon going to be infected with the virus, and we're going to see upwards of 1 million deaths. Do you think that is something that could actually happen, or it's a far-fetched estimate?
Thank you. So first, I want to say, yes, now there are ongoing outbreaks happened in China, and it started from the so-called lifting of the zero COVID policy. And I also have noticed that there are already a lot of coordinated propaganda that because China has protected citizens for over 3 years, so it's the time they have to suffer the infection. And also China claims that they control this outbreak very well as before, but that is not true. The thing is, I'm also in contact with many people in China now, including doctors and patients. What we have seen is, first, a lot of things very unusual. The outbreak suddenly simulators come out together from multiple areas in China, especially in the cities which had a lot of white paper revolution. And it happened at the same time. Also, majority of citizens get infected in a very quick speed. And also the symptoms are more severe than the Omicron symptoms on average. They are like high fever, pain, and also GI symptoms, as well as pneumonia. The death toll is increasing like crazy. Also, we have seen other things very similar back to 2020, early 2020 in Wuhan. At that time, Chinese Communist government claimed that the pandemic was under the control. However, it's like that time, China said the same thing. And also China controlled the treatment at that time, because now people are not allowed to purchase the painkiller or anti-fever drugs. It's not only because of lack of drugs and lack of manpower. It's also because government is controlling the supply of the drugs. They want to see people suffer and even see people die. So there are many things I'm now working with US side and to provide the information. We need to be aware of that.
Sure. So, Dr. Yan, are you saying that perhaps the government prematurely lifted the restrictions, the zero COVID policy that was in place because of the backlash that they were facing, and they didn't really have a plan in place of when those restrictions would be lifted, what happens? And that is the price that the people of China are now facing.
If you mean that compared to the zero COVID policy period, at that time, yes, China has done very strict policy like lockdown and send people to quarantine camping, and also torture them. But it is not for the public health. It is clearly for the control. And as we already always emphasize in media and reviewed through the People's Liberation Army's meeting content, that China is moving the society from peaceful time to the wartime. So this is one way to do the mobilization, to minimize the people's daily costs and transfer to military countries. But now when they claim they lift the zero COVID policy, there is actually not that much of difference in public health compared to the zero COVID policy period, because the government never really care about public health. So that's why if China government try to contribute the reason of the current outbreak to the zero COVID and the policy change, that is not responsible. And we also need to doubt that because China military has developed the COVID-19 virus and released it all over the world, and they get the benefits from the pandemic. So what can they do now? Do you still trust them? Whether the new variants are naturally originated from the China society now, or they come out from the lab, or whether something else happened. And also the China vaccine Chinese people use is the made in China inactive vaccine. Most of Chinese people get 2 to 3 doses of inactive vaccine. This can cause, potentially this can cause antibody-dependent enhancement. And this could be also one of the reasons contributing to the current outbreak. There are many factors we have to evaluate.
Sure. But, when the virus broke, when the pandemic outbreak happened, not just in China, but around the world as well, the allegations of suppression of facts by China came to the fore, given the kind of control China has on the kind of information that goes out, be it about where the virus originated from or the number of deaths or the number of cases that were being reported. Do you think something similar is happening now as well?
Compared to the early pandemic happened in Wuhan, yes, I see a lot of similarities. Except for the things I mentioned to you, also we see that military's role is important in the outbreak. For example, in the People's Liberation Armies, the Chinese military's top media, they have already published the article recently on behalf of CCP and Xi Jinping to talk about the military's role in this anti-COVID at this moment. So we need to think about when the civilian hospitals are overloaded, how could they guarantee the military can exert the function, except for some other plans they have already. And also, we see people are suffering the infection, suffering the disaster, but we didn't see the report about the military outbreaks. Instead, we see China Navy and the Russian Navy now are preparing for the drills in the East China Sea to show the military capacity to the world. So you really need to consider all the things together and get the right conclusion.
Absolutely. There are multiple factors that are responsible, and multifold should be the response as well. Dr. Yan, thank you so much for speaking with us here on CNN 18 and sharing your perspective.